Hello everyone, welcome to All About Physiotherapy. Today we have with us someone who believes in finding the root cause of her patient concern rather than simply treating the symptom. She is a specialist in orthopedic sports and women's pelvic floor therapy. Hello Dr. Jessica.
Hi,
How are you?
I'm good. How are you?
Yeah, I'm good. And what about the COVID-19 thing? Are your people safe over there?
Yeah, we are still mostly in quarantine, but some states are slowly reintroducing opening, certain aspects of business and letting some people in lower affected areas go out. So, how's everything over there with you guys?
Yes, here also the quarantine is there. There is a lockdown over here in the whole country.
Really?
Yeah.
Yeah, it's
So,
been tough.
yeah, the tough timing is going on.
Yes, absolutely.
Yeah. So, should I start with the questions?
Yes, go for it.
So, my first question to you is, tell us something about PACE physical therapy.
So, PACE physical therapy is a holistic practice. And what that means is we work with a lot more than just the physical musculoskeletal system. So we see all our patients one-on-one, typically for an hour. And in that time, we get to work with people and talk more about their past histories, if they've had any traumas, whether it's mentally, emotionally, or physically. We get to learn a little bit more about their nutrition, their stress, their job satisfaction, family life. All of that kind of information is helpful for us because oftentimes if we're treating chronic injuries or issues that keep coming up and going away and can't be fully resolved, it's often an underlying root cause of something more than just the physical aspect. And so we really focus on just trying to meet our patients and learn more about them from an individual standpoint, and then work with them a little bit more closely as we're trying to rehab whatever injury that they're seeing us for. So it's a lot different than most of our clinics here. I'm not sure how it works with you guys, but most of our clinics, we're seeing a lot of patients, at once, and we're doing a lot of exercise, but not as much talking. And so PACE physical therapy is different in that sense, but it's also fun, and you just get to explore and learn a little bit more about people.
Okay. So, tell us something about your daily routine. How is it?
For work
Your daily routine.
or for life? Okay. So right now it's a little different because I haven't been working in clinic. So everything that I'm doing with patients has been
During your
remotely
working
online.
hours. When you
Yeah.
work.
So typically I'll wake up and I have early morning patients before they go to work. And then I'll work on, emails or filming videos to send to patients or doing social media videos and things like that to help people around the world. And then oftentimes we'll have more patients around lunch and then again in the afternoon around the end of work time. So doing a little bit of patient care and then a little bit of marketing throughout the day is a pretty regular routine for me.
Okay, so as we have seen that you work on women's pelvic floor therapy. So how physical therapy can help women pre and postnatal?
Yeah, so physical therapy is actually very important pre and postnatal. It's not something that a lot of people do though, because most people don't understand what it is or the benefits of it. And just like any other body part, there's a lot of changes that go on into your pelvic floor and to your core when you are pregnant and when you're postpartum. And so we focus a lot on educating people about their pelvic floor muscles and what is tight, what is weak, how to strengthen things correctly, how to work the pelvic floor with the core for low back health, for hip health, for safe return to exercise, and also so that they can properly care for their child. And so it's very important, it's very valuable, and over the course of even just the past year or two, more and more people are hearing about it and coming in more for it, which has been good. But it's definitely something that we need to educate a little bit more about so that more people take advantage of it.
So why is it important to strengthen pelvic floor muscles according to you?
So the pelvic floor is the bottom part of our core. So if we don't have a strong pelvic floor, then we have like a major part of our core that's just not working and not supporting us. And so that affects a lot of back pain and a lot of back injuries. It also is very commonly affecting hip pain and hip injuries. And so it's a very important part of our body, just like our shoulder, just like our knee. And most of us don't do anything to strengthen it or to pay attention to it throughout the day. And so giving that kind of guidance and that instruction on how to actually correctly activate those muscles, keep them from getting too tight as well as too weak, is very important, just so that from a functional standpoint, the whole body is supported, the core is well-rounded and strong, and then future injuries are less likely to occur.
Okay. My next question to you is, why should someone visit a physical therapist other than going to any doctor if he or she has pain?
So physical therapists help with the musculoskeletal system, which is, everybody thinks about their muscles, their bones, their joints, which we need to all be working functionally and healthy throughout the course of our lives for general quality of life, but also to help manage aging, which is going to occur for all of us, to help prevent injuries, and to also keep our nervous system and our internal systems happy. Because if our muscles, our bones, our nerves, if they're not working well, then that causes tension, tightness, pain, decreased motivation to exercise or to move because you don't feel good. And then that can cause you to mentally not feel good. So have depression or be less motivated or just not do things that you should be doing for yourself to keep your body healthy in a preventative way. I like to tell patients, if we are getting our car checked or if we're getting our eyes checked, we're doing that preventatively before something bad occurs so that something bad does not occur. And it's the same concept with our musculoskeletal system. We want our muscles, our bones, our nerves, our joints to be moving and working in a good way so that down the road they don't stop working on us and lead to injury.
Yeah. So people usually think that if there is pain, you should go to an orthopedic or some other doctor first and then go to a physical therapist. So what is your point on that?
Mm-hmm. I think it depends on the case. So in our country, we have direct access. So for most states, people can come see physical therapists right away. But most people don't understand what physical therapy is. So they think physical therapy is only for after a surgery or after a fall or after a major injury. And as we grow as a profession, we're trying to educate people and let them know how most things, especially with your musculoskeletal system, can be addressed without surgery or without medicine, and can be improved quicker if you see your physical therapist doctor first, rather than your orthopedic, who's going to probably prescribe you physical therapy and or medicine, or your surgeon who's going to want to do surgery on you even if you don't need it. And so just bringing awareness to all of the things that we can do as physical therapists to improve your range of motion, to increase your muscle strength, to functionally make you work better is possible, but also going to be a more efficient use of your time if you're just aware of the services out there.
Right. So why is mind-body connection important when it comes to healing, health and recovery?
So our mind and our nervous system control the body. Our nerves innervate everything to make us move and function and, live. And so if we are not connected, like if our mind is thinking about one thing, if we're fearing pain or if we're dealing with stress and we're not relating it to how it's making our physical body feel, it's going to affect us from, maybe having increased muscle tightness or making poor body movement decisions and leading to an injury. In the same sense, if our muscles and our, joints and body parts are working independently of what our mind should be controlling them to do, then they're not going to be on the same page. So you're going to have your body trying to tell your mind something, your mind trying to do something different, and there's going to be no communication. And both of them have to be working together so that our systems flow, and so that we have decreased stress, so that we have improved decision making, and so that things are more relaxed just from a muscle standpoint and not so guarded and tense.
Yeah. So my next question to you is, when do you prefer dry needling the most?
It depends on the patient. So they have to be willing to get needles, first of all. And a lot of patients nowadays, they're very receptive to it just because acupuncture has been around for so long. And so the needle concept is not uncommon. And I like it for two cases. I like it for those with acute pain if they're having like a big or strong muscle spasm or trigger point, especially in like the shoulders or the low back. It's really nice because it goes into the muscles and essentially tells the body, hey, we need to reset this area. You're sensing an injury, so you're sending a bunch of chemicals that cause the inflammation that are trying to that are making the muscle spasm. By introducing the needle, you're telling the body, okay, I need to flush this out. We need to bring in those good cleanup chemicals, let the muscles reset, and then retrain them from a strengthening standpoint so that the trigger points or the spasms don't keep occurring. So that is for acute injuries. Now for chronic pain, I also like it, but for a different reason. And so for chronic pain, oftentimes the body has had a prior injury and they haven't fully recovered. So their body part is holding on to this past tension and this past trauma, and it has adapted it as its new normal. So instead of going back to normal pain-free function, it now thinks that this painful function is normal. And so the chemical systems within your body aren't doing anything to reset that area. So when we introduce a needle to that type of injury, we are essentially restarting the inflammation process. So we're telling the body, this is a new injury. I'm going to insert this needle. You need to now bring in all of these inflammation chemicals to deal with this injury. And then with that, it alerts the body to, hey, this is not your normal. We need to fix this. We need to improve this. And then again, similar to with the acute patients, we will follow it up with exercise and muscle retraining so that the body now adapts to that new normal that they should have had initially after that injury.
In one of your posts on Instagram, we have seen that there was so much of tightness that the needle got bent. So what was that?
Yeah, so that was an active trigger point. And so that the patient just had a really strong, so a trigger point is like a buildup of chemicals causing, pain, tightness, a knot, if you want to think of it that way. And for that particular patient, he just had a very big active trigger point. And so when we got the needle right into the trigger point, and as it's releasing, it causes that final contraction to bring the chemicals in, bring the blood flow in, increase the circulation. And it was just in a very strong muscle. And so it takes the needle, bends it a little bit, and then you can tell when you pull it out that you got the right spot because the contraction worked. And then the muscle felt much better right afterwards, and he could tell that things had been reset a little bit.
Okay. So one advice that you would give women around the world for not compromising with their health?
Focus on prevention. So it's so much easier to stay healthy if you do things ahead of time to keep yourself healthy, as opposed to reacting once you're not healthy. And so I'm a very big fan of eating healthy, doing regular exercise, working on stress management, getting enough sleep so that your body is functioning in a happy, healthy flow state of way every day. So that if you are dealing with, an ankle sprain or a car accident or something that you can't predict, it's more likely to be able to handle that without everything else in your body being affected. And so the more things that you can do preventatively to keep your body healthy, the easier it's going to be to age, to recover after another injury, and to overall just prevent a lot of diseases and other conditions that would occur if you did not take that preventative approach.
Okay. So my next question is, why foam roller?
For some people, they just like how it feels. For other people, so from a scientific standpoint, it's doing more to kind of calm your nervous system down and to decrease your pain threshold. So it's not going to break up scar tissue. It's not going to break up muscle tension. It's going to work on your muscles by calming down your nervous system. So once you have that sustained pressure, it feels intense at first because it's hard pressure on a tight muscle. And so as you do it more, your body gets used to that pressure and then allows itself to relax. And it's your nervous system saying, oh, okay, I know this isn't a dangerous thing. I know this isn't a bad thing. So now I'm going to be a little bit less sensitive to it and calm down. And then with that, it's going to help everything else kind of desensitize a little bit and not feel as intense or painful as it was before.
Okay. So my next question to you is, this is a personal question, by the way. Who has been your inspiration and why?
Oh, that's a good one. So when I was young, so I grew up playing sports my whole life. And one of my coaches for basketball was a physical therapist. And she coached me from like, 5th grade through high school. So I was with her for a long period of time. And I had a number of injuries. And so she would help me recover from those injuries. And it was just a really good experience because I saw how she blended the body and health and healing with staying active, playing sports, and having fun. And she did it in a very compassionate and professional way. And so I just had a very good role model from a young age that I loved what she was doing. I loved that she could coach sports, and I loved that she knew the body so well that she could help me get better. And so from early age, I knew I wanted to do something with exercise and something with the body. And as I went through school, physical therapy just seemed like the perfect fit for me. And I was also able to get mentored by this physical therapist along the way. And she showed me, what good physical therapy looks like and how, connecting with a person and building that relationship is so helpful for them to trust you and to, stick with exercise and health and all of that throughout the period of your lifetime, so that it's utilized more than just, once for some pain or for some injury. It's more of like a lifestyle habit. And that's what I've tried to portray, especially with PACE physical therapy when I started it a couple of years ago, because I think there's so many opportunities we have as physical therapists to truly help people. And sometimes it helps people way more than just the physical standpoint. And that's a very rewarding thing to be able to offer to people.
Okay. So how useful do you find these social media platforms like Facebook, Instagram to grow your business as a physical therapist?
Yeah, so they've been pretty helpful. I use both of them, but they both kind of present to me different types of patients. So with Instagram, it's something that I can connect very easily with people all around the world. I have patients in multiple other countries. I, get questions from people all around the world that I'm able to talk to and help and offer this new light into physical therapy that they may not have experienced in their own personal life. So it's been really cool just to be able to meet so many people around the world. But it's also shown me like, what is the need out there for people similar to my age doing things similar to me. It allows people to be attracted to you because you're offering something similar to them or something that can help them. So it's a pretty immediate response to knowing, okay, am I putting out good information that's helpful? And if I'm not, can I look back and see what's helpful? And then so it helps gear your content and know what people out there are really wanting to see. With Facebook, it's been nice. I have a little bit of an older population on Facebook. And so it's nice because they have slightly different questions and concerns and issues that they're dealing with. And so making sure that I can give content and exercises and things like that that are appropriate to them, as opposed to some of the higher level or unique things that I put on Instagram. And so it's fun just being able to work with different types of demographics, because then I don't get bored and I can constantly keep evolving as a physical therapist. So it's been very helpful from a business standpoint. I have a couple of online programs that, anybody can purchase and use around the world. And then I also have the capability of, having these online consultations with anybody around the world. And so it's just been really awesome to meet people, learn about different cultures, and help people with their bodies.
Okay. So my last question to you is that one advice that you would give all the physical therapists around the world to be as successful as you are?
To be passionate. With the career that we have, we can do so many things. So don't feel like you're stuck in one particular thing if you don't enjoy it. And if you get burnt out or if you get bored with it, because there's so many other ways we can take our profession and mold our career the way we want it, so that not only are you better able to help people, but you also are leading a fulfilling life, and you know that you're doing what you're meant to be doing in the long run. And that shows with people that you meet. Patients can tell when you're truly invested, when you like what you're doing, and when you're happy to help them. So I've worked in a couple of different situations, and I've learned things across every platform, and it's kind of molded me into where I am today with my own business, because I knew exactly what I didn't like, and I knew exactly what I wanted to do. And even as a business owner, you can grow and continue to expand in any way. So if you have a passion, follow that and make your job follow suit to that road, so that you just feel fulfilled and you can help people.
So, Dr. Jessica, have you ever been to India?
I have not.
Okay.
Have you ever been to Texas?
No, I have not.
Yeah.
So, do you watch any Bollywood movies from India?
I don't think so. Or name some popular ones?
There are many popular ones. Three Idiot is there. Then many movies are there.
Yeah. Yeah, I haven't watched a lot of movies lately just because I'm busy, but
Okay.
I hear good things.
Yeah, I'll send you some links of the movies.
Okay, sounds good.
And so here we had a great interview with Dr. Jessica. Thanks for your time, and thanks for taking time early in the morning.
Yes,
And
absolutely.
it was an honor to interview you.
Thank you. Thank you for having me.
We come to an end of this interview. Okay. Anything you want to tell our audience?
No, just good luck with everything. And it's a great, rewarding career. So have fun.
Okay. Thanks a lot. Bye bye. Take care. Have a good day.
Thank you. You too.